Global coronavirus numbers continue to rise. Over the last 7 days, more than 815,000 new cases have been recorded daily. That's despite large-scale vaccination rollouts in the past few weeks. This raises the question, are the COVID-19 vaccines working? Why is it that daily global numbers are the highest they've ever been, despite hundreds of millions of people having been vaccinated in different parts of the country? Professor Kollega Mlisana is a co-chair of the Ministerial Advisory Committee on COVID-19 here in South Africa and is joining us now on the Midday View to discuss some of these issues. Prof, good afternoon. Welcome to the Midday View on eNCA. Thank you very much for joining us and thanks for your patience. We've seen India recording some of the highest daily infection rates ever reported since the when the coronavirus pandemic began last year. I mean, the numbers are just going up and up. Can we start in India currently? What's your sense? What's happening?
Yeah, thanks. Good day or good afternoon, Dan, and thank you for having me. And good afternoon to all the viewers. Yes, actually, I think at the moment, India is really having a huge crisis. For instance, they now are seeing for the past 6 days, more than 320,000 cases per day. And this supersedes what we're seeing in the US earlier on. Now, the issue that we need to always keep in mind is that, firstly, India is actually densely populated. And if you're looking at their first wave, they really had it under control within, reasonable time. And what everybody feels is that maybe they did let their guard down and did not pay as much attention, even as the early signs of a second wave started creeping in. As a result now, and also the variants that have been circulating in India, because initially when this second wave started, the majority of cases that they were seeing were caused by the variant that was first identified in the UK, which is the B117. But now they have seen another emerging variant, which is being named B1617. Now, obviously, looking at the numbers and the very skyrocketing numbers of infections, we still need to get a better understanding of the characteristics of these new variants, but they seem to be just like we saw in the UK and even for that matter with the variant that was discovered in our country. This seems to actually be highly transmissible, and that might be the reason why we're seeing such high numbers. So the question that you are, you including and mentioning about what's happening with the vaccines. Now, as we have seen that actually now that we know about these variants, every variant that emerges, the first thing that we need to do is to actually test that variant against the currently used vaccines, because we are understanding that there are certain variants which actually the vaccines that are currently available do not respond as efficiently as the original virus. And so it's going to be important to make sure that as each of these variants are emerging, there's actually rapid responses to test them against the currently, used vaccinations. And what is going to be important as well, then, is whether the vaccine developers are actually can respond quickly to be able to tweak the vaccines so that they then, so that the current existing and emerging variants respond efficiently and effectively.
I guess planning will be part of it. Awareness is the other aspect. If we look at our situation in South Africa, just yesterday, I spoke to Sihle Zikalala, the Premier of KwaZulu-Natal, about 3 districts they are worried about in KZN, where they are seeing a rise in numbers. I also spoke to the MEC of Health from the Free State province, another province where several districts currently are seeing a rise. Similarly, in the Northern Cape, parts of that, and the Northwest. So while there is an awareness, there has to be planning, because, for example, India is finding its health system buckling under a lot of pressure at the moment.
Mm-hmm. Definitely, you spot on. Now, what becomes important, we don't want to find ourselves in the situation where maybe India found themselves, where we're letting our guard down. So it's important for us to actually be vigilant. And for me, vigilance must be at all level. And when I say all level, I always want to start with us as individual South Africans. What do I do to prevent myself from being infected and the loved ones and those around me? And that's where the whole issue that we cannot overemphasize non-pharmaceutical interventions at individual level, at community level. But also, then it becomes important now as the Department of Health to make sure that the systems that have been put in place to monitor first testing, to monitor contact tracing and testing, monitoring the numbers as they emerge. Once we identify cluster infections, be actually very quick in responding and ensuring that contact tracing is done, and that then gets controlled before it gets out of hand. So it's going to be important to make sure that all these steps are taken by each and every responsible, category within the country.
Professor Mlisana, thank you very much for your time, and happy Freedom Day to you. Thanks for taking time out on this important holiday in the country to talk to us here on the Midday View on eNCA. That's Professor Koleka Mlisana. She's a co-chair of the Ministerial Advisory Committee on COVID-19 in the country.